Welcome to another case study. So today's case study is saying a 2-year-old. So sorry, it's supposed to be a two, not that one. So a 2-year-old girl comes presents in OPD with history of diarrhea and vomiting for 2 weeks. Then her weight is 5.5 and she weighs 7 centimeters. Then using the table below, answer the following questions. So this table is for 2 to 5 years old. So that's why we've been used for 2-year-old girl. So work out for so remember this one is particular for the 2 to 5. Then work out the weight for height, standard deviation. Then this is B, what is the diagnosis? Then C, how do you manage severe dehydration in above diagnosis? Then D, what are the fatal complications? So what are the fatal complications of the above diagnosis? Then E, list 2 risk factors of the above condition. So work out the weight for height. So weight, so these numbers we are seeing, for instance, this one like 5.6, that's the weight. Then this like 6.5, that's the centimeters, and shoot the height. Then this particular one is a 5.5, so somewhere 5.5. So 5.5 is falling in the ratio of less than 3 SD, meaning it's not EA. Because if it was EA, meaning it would have been on let's say -4 SD. So since it's not EA, we're just going to say less than 3 SD, because even the height is 67. So 67, the only option which can give you is 67 and the weight of 5.5 is -4, which means which is not even here. So if you use the weight, which is 5.5, you can find that if this table was to be expanded, you can find that it's going to give you -4. So specifically here we are not going to say -4 because we haven't seen it. So we are going to say less than -3 SD. So the answer is less than -3 SD in short. So that's the answer. So less than -3 SD. Then work out that's the standard deviation. So the answer is less than -3 SD. Then what is the diagnosis? So this is severe acute malnutrition. Then how do you manage severe dehydration in the above diagnosis? So some and severe dehydration use the specific rehydration solution known as rehydration solution for malnutrition, which is the urisomal, which should be given at 5 mils per kg in every 30 minutes for the next 2 hours. Then in the other 2 hours, in the next 10 hours, we're going to be alternating. You're going to be giving it in alternating hours, and you have to also alternate feeds in between. Okay, so that's reasonable. So then what are the fatal complications? So fatal complications, so in the 10 steps management of some, the hypoglycemia, hypothermia, your dehydration, your electrolyte loss, your infections, those are the fatal complications. So just put those ones I've mentioned, those are the fatal complications. So hypoglycemia, hypothermia, dehydration, electrolyte loss, electrolyte imbalance, and your infections. Those are the fatal complications. Then list so for the infections, you can even mention, if you want to, you can mention pneumonia as an example. Then list 2 risk factors. So risk factors we can have so for the risk factors we can have we have a lot of risk factors. So we have risk factors that are associated with infections such as TB, HIV, Down syndrome, and diarrhea. Then we can just have risk factors associated with the socio-economic status. So meaning of poverty-ridden families, war, drought, then unemployed mother, lack of female empowerment. So those are some of the risk factors. Like the list goes on and on for severe acute malnutrition. So those are some of the risk factors I've mentioned. So that's the end of the case study, and some different additional information that if you may be asked on, let's say, how to grade dermatosis, you can say they have a mild, moderate, severe, where so the dermatosis is caused by lack of vitamin C, A, copper, and the list also goes on. So we said the grading is mild, moderate, severe. So mild, which is a +1, this is where we just have discoloration of our skin, or there we have where we just have few patches. Then for moderate, meaning +2, we just have multiple patches on skin and or on legs. Then for the severe one, we have which is the +3, where we have a flanking skin or raw skin or fissures in short. So meaning we have a lot of patches, and they are even flanking the skin or the raw skin, or they are even making fissures. Then if you asked about how to grade edema in some, we have mild, moderate, severe, +1, +2, +3. So the +1, the mild one, is just both feet alone. Then for the moderate, +2, it's both feet, then plus the upper plus the lower limb, meaning your thighs are affected, then your hands as well, or the lower arms. Then for the severe, which is your +3, so everything we mentioned in moderate plus face swelling, that makes up the severe edema in some.